Funding for the production of Kentucky Health is provided in part by Jewish Hospital and St. Mary's Healthcare.
Kentucky is the most edentulous state in the Union. What does that mean? We have no teeth in Kentucky, and that's a real problem. Stay with us for this next segment of Kentucky Health to find out what we can do about it. Hello, and welcome to another segment of Kentucky Health. Kentucky Health is a show that addresses healthcare concerns that affect all of us living in Kentucky. Today we want to talk about dental implants. Why? Because we in Kentucky, by far and away, have fewer teeth than everybody else in the Union. And that's a real problem for us because, as we know, poor dental health affects how we eat and thereby the rest of our health. Today we have with us two guests. The first is Dr. Kenny Livesay, who is with East Louisville Oral Surgery and Dental Implants. Kenny, thanks for being with us today. We also have Mr. Chris Frudenberger, who's a representative from Strawman Dental Implants. Chris, thank you for being with us today. Now, Kenny, I said that Kentucky is the most edentulous, or in other words, we lead the nation in loss of teeth. Is that true?
That is true. It's a combination of a lot of things. You know, missing teeth knows no boundaries. You've got little kids that are missing teeth from dental caries, eating too much candy, improper oral hygiene, to the elderly missing teeth just over age. And then anywhere in between, trauma, sports injuries, things like that are all reasons we lose teeth.
Are we automatically going to lose our teeth as we get older if we take good care of them? Is this something that's programmed in?
Well, as with anything in healthcare, there is a genetic composition to everything in healthcare, and certainly that plays into it. But if we are good about going to the dentist, good oral hygiene, fluoride in our drinking waters, we should be able to maintain our teeth for longevity. So,
what is good oral health?
Good oral health is brushing your teeth at least twice a day, flossing your teeth, and maintaining regular dental visits at least twice a year.
So, of the common things that we see, is the most common thing that causes us to lose teeth because of cavities?
It is. Cavities and periodontal disease. And periodontal disease basically is just referring to inflammatory process of the gums due to plaque and buildup of bacteria in the mouth.
So just simply brushing can prevent these sorts of things from occurring?
Absolutely.
Fascinating. Simple little preventative activities.
Preventive medicine, yes.
Now, when we lose our teeth, I guess, is that a big deal?
It is a big deal. The whole issue of healthcare and how dentistry plays a role in that is becoming more mainstream every day about how periodontal disease affects overall health. Of course, in digesting your food all begins in the mouth, and so that's where the process begins. So obviously not having teeth to chew up your food properly and to have good diet with that will play over into the other aspects of healthcare.
Is there, beyond, I guess, the aesthetics of it all, does it otherwise impact upon whether we get infections in the jaws or anything like that?
It does. Teeth are barriers to the mouth and to the oral cavity and the digestive system, and certainly your ability to chew up your food properly and keeping good saliva production in the mouth to keep bacteria counts down are all crucial aspects of digestion and good ability to chew up your food.
What about smoking and or drinking? Does that impact on oral health?
It does. Smoking, nicotine does cause blood vessels to constrict and your ability, inadequate blood flow to the oral cavity. It certainly affects the mouth like any other organ in the body.
So now, a person loses a tooth. What do the rest of the teeth do? Do they stand there, or is there some other changes that take place?
Now, a lot of dynamics occur, even with the simple as just one tooth loss. Obviously, the cosmetic component of that if it's a front tooth, but the functional aspects of it are many. When you lose a tooth, there are teeth on either side of that missing tooth at that point. Because those teeth no longer have a tooth in between them, teeth will drift and shift into that space. When that occurs, your bite may change. Tooth roots also stimulate the jaw to keep producing new bone, and once that stimulation is lost with the loss of a tooth, then the bone will also deteriorate as well. So
let's see this slide. Okay, then your slide here, is that what we're seeing here, where that tooth on the bottom is moving. Everything's moving to the middle there?
That's correct. Several things are happening that you see on this slide. If you look at the teeth on the bottom adjacent to the missing tooth now, what is occurring is the teeth are now trying to fall into that space because there is no longer a tooth there to keep those teeth into that position. The second thing you see there in the slide is the opposing tooth. The tooth directly above the space no longer has a tooth to hit on. And because of that, a phenomenon occurs called supereruption, where the actual tooth above it will start to work its way out of the gum tissue because it no longer has a stopping point of the tooth below it. So not only do you lose the one tooth below it, but over time you could lose the tooth directly above it. And the other thing you see is the bone is starting to melt away a little bit there, where there is no longer a tooth root to stimulate the jaw to keep making new bone.
Okay. Now, is it more common to lose one of the front teeth as opposed to one of the back teeth?
It's certainly in a trauma, sports injuries, automobile accidents, it's much more common in a trauma situation to hit your face in the front and then loss of teeth that way. In terms of dental decay, usually in the back teeth are more the culprit of dental decay and periodontal disease because people don't tend to brush all the way in the back of their mouth adequately. They tend to focus on the front and sometimes miss areas in the back of the mouth.
Okay, now on this next slide that you brought with you, what is it that we're seeing that's so important about what this new tooth is doing, or what that implant, I guess, is doing?
Yeah, this slide illustrates basically the benefit of a dental implant and its similarities to an actual tooth. And the one thing that a dental implant does, like no other aspect in dentistry, is that it does replace the tooth root. A dental implant simply is a titanium screw or a post that goes down into the jaw that replaces the missing tooth root. And in doing that, it enables us to place a tooth on top of that tooth root or the dental implant.
Okay, what does the root do?
The root gives stability to the crown of the tooth to allow for chewing, so it provides an anchor to the tooth for chewing purposes.
Are there vessels that come up that way too?
There are blood vessels that supply the area through the bone, and that stimulation that the tooth root or dental implant provides keeps the blood flow and circulation to the area, and new bone is being made.
Now, I remember I had a tooth that was extracted when I was a lot younger, and they put a bridge in. So what is the purpose of a bridge?
A bridge is a nice restoration as well, and that's nowadays more mainstream dentistry. Obviously, a dental implant is a much better solution for a variety of reasons, but a dental bridge is another way to replace a missing tooth.
Now, in this slide that you have here, we're looking at a person with a bridge, and what are the changes that occur there?
A couple things you notice here on the slide. It shows a missing tooth in between two teeth, and when you see that, again, your options to replace that tooth are either to bridge the two teeth together on either side of the space, and how you do that is you actually have to remove adequate tooth structure of the adjacent teeth on either side of the space to accommodate a crown to go over top of it. So you are taking two perfectly healthy teeth, removing good sound tooth structure in order to have a crown placed over there, over those teeth to make a bridge. So that's one big problem with the dental bridge. The other problem with a bridge is the average life expectancy of a bridge is about 10 to 15 years. If you ever have a problem with the tooth on either side of the bridge, you will lose the entire bridge. The great thing about the dental implant is you're only simply dealing with the missing space. So you replace the one tooth, you don't touch the teeth on either side, you preserve that tooth structure, and then if you ever have an issue with either tooth on either side, you're only dealing with those teeth.
So you have the bone loss that's occurring where that bridge is covering over top of
That's
that
correct.
space.
Underneath the fake tooth in the bridge, there's actually bone loss taking place because there's no longer stimulation in the bone via a root.
Okay, if you do an extraction on a patient, can you put an implant in immediately, or do you have to wait some time before going back and doing that?
You can. In certain situations, we like to offer that service to patients. There's a lot of factors that dictate whether or not we're able to do that. In some situations, if there's not adequate bone in the area after the extraction, then we have to let a healing period, typically of about 3 to 4 months of healing, for bone to regenerate in that tooth socket before we'd have an adequate bone for a dental implant.
So in this slide that you have here, is that what you're demonstrating?
Yeah, in this slide, what it's showing is actually the removal of a tooth in the office and then simultaneous placement of a dental implant. And our ability to do that is dictated on there's no infection at the time of placement of the dental implant in the socket. We have good bony walls to place that dental implant into to gain stability of the implant. As long as that implant is stable within the bone will heal around it and will grow around it. It's kind of the analogy of if you fractured your arm and you had a cast on your arm, you put that cast there to keep the bones from moving. It's the same principle. We don't want that dental implant to move while it's in the bone so that the bone can heal around it.
So it's more advantageous to put it in right away?
Absolutely, because it does preserve the bone in the area.
Now, Chris, you were kind enough to bring with you some of these things that are implants. Now, I recognize that you have some that I assume that are larger than life, and then you also have an implant that is, or the post at least, that's normal size. Could you go over these things with us?
Yeah, this is it's actually a dummy implant, we call them, but it is the actual size that would be placed in the patient's mouth, this one here. And once it's placed, usually at that point there's a healing cap put over top of that, and then the patient's sent home for 2 to 3 weeks for a follow-up visit, and then up to 2 to 3 months before you would restore that implant. This, for demonstration purposes, is a lot bigger implant, obviously. It's not placed in the patient's mouth, but it'll help show what we do from the restoration process. Once the surgeon, which works very closely with the dentist, has released the patient, everything's stable and ready to be restored, then it's sent back to your restorative office, and then the restorative process, the part above the gum, it takes place at that point. Normally at that point what they do is they've taken the proper measurements and figured out what exactly they need as far as restoration process, and they will place what we call an abutment in place.
Yeah.
This is done at the restorative at their dentist.
So wait a minute, the part that you're holding in your left hand is actually screwed into the bone.
Yeah, this is the implant. This is in the patient's mouth at this point. And then when they come back to the restorative office, they take their measurements. The abutment is placed. At that point, they'll take an impression, actually, of the patient. And when that's sent off to the laboratory and the final crown is made, a couple weeks later, the patient comes back into the restorative office. This crown, obviously, this is much bigger than the real thing, is placed in the patient's mouth at that time. You've got 2 different options. You have a screw retained, which this is, or you also have a cement retained restoration process that takes place, depending on the patient and that patient's situation. But at that point, it's torqued into place, tightened down to a certain amount of force, and the patient's sent on their way.
And that's how it goes?
That's how it goes. Very simple process. You have a lot of patients talk about the implant procedure itself is less painful than a tooth extraction, actually.
Now, I recognize that that's for demonstration purposes, but is the tooth or the crown that's put in there, is it always clear or?
No, it will be the tooth color. The dentist at the time of the restoration will have a series of templates, so to speak, and they will measure the color of the surrounding teeth and match exactly the surrounding teeth.
How long has this been available?
Dental implants have been around for roughly 20 to 30 years. And actually, some of those implants, a lot of those implants are still in the patient's mouth today.
So this is something that if you put it in, we can expect long-term results?
Forever, almost, really, forever.
Well, Ken, you were kind enough to let our cameras come into your office, and we were able to film you actually putting an implant in place.
Yeah.
Why don't we take a look at that and just describe to us what's going on here?
Okay. This is the preoperative x-ray showing missing teeth in the lower jaw on both sides in the posterior areas. These teeth have been missing for a long time, and one of the ways we know that is you can see how the bone is concave in that area. The bone is dipping down from bone loss.
Now, who are these people that are helping you?
Yeah, this is my 2 surgical assistants. This is Jerry and Deborah, and they're helping me throughout the procedure.
Okay. And what is this instrument here?
This is showing the dental implant motor, and these are the dental implant insertion devices that we use to create the space in the jaw for the dental implant.
Now, that 800, what does that mean?
That is the speed that the drill is moving in order, 800 Newton centimeters, in order to place the dental implant, to create a pilot hole, so to speak, for the dental implant.
So you're drilling into the bone at this point?
That's correct. We use local anesthetic typically. The patient also has some laughing gas on in this video. And we make an incision in the gum tissue. And we reflect back the gum tissue to expose the bone. Once the bone is exposed, we take various measurements to see the amount of width of bone that we have to work with to place an adequate sized dental implant. I'm taking some measurements there, and now I actually have a prefabricated surgical guide that I make ahead of time in surgery that helps me decide where I would like to place that dental implant.
Are you going right in the middle where the space is?
Pretty much. I try to center the implant into where the teeth are. We do have to allow for things such as the tipping of the teeth. If a tooth has been missing a long time, there's some angulation issues with the dental implants.
This is the implant in place on the X-ray?
This is actually an index pin that is in the intermediate process of placement of the dental implant, and it's kind of guiding me on showing me radiographically where I'm heading with the dental implant.
I see. Typically, how long does this procedure take?
Typically, a single dental implant will take about 45 minutes to an hour to place the procedure, to do the implant from start to finish.
Okay, so this is working on the space itself now?
We are. This is reflecting the tissue back, and we're actually using different sized drill bits to create the osteotomy or the hole in the jaw for the dental implant. And we always try to place the longest and widest dental implant we can fit into that space to give the tooth crown as much support below it with the dental implant.
So you start off with a small hole, then make it bigger?
That's correct.
What is the patient feeling?
Basically, the patient is feeling nothing other than small amounts of pressure. They have local anesthetic. They feel pressure. They know that I'm doing something, but there is no pain or any discomfort at all with this procedure.
Now, you have a wrench.
Yeah, this is what we call a torque wrench, and that allows insertion of the dental implant. So we insert the dental implant with it. It's called a torque wrench, and we torque the dental implant down into position with that device.
And that is now secure, and it's not going to be moved.
That's correct. That implant is secured down into the bone. It does not spin. It does not rotate at this point, and it allows for the healing process, otherwise known as osseointegration, where the bone will integrate into that dental implant.
Well, Chris, I think you'll agree that that was probably one of the loveliest smiles that you probably had the pleasure of seeing. Would you not say so?
Definitely.
I think so. Now, what happens then? That patient has that implant in place. Now, we just saw just the rod. So they go back to their dentist, or do they stay with you at this point?
Typically, there's two ways to do it at this point. We'll either put a flat cover screw on the dental implant and then suture the gum tissue over top of the dental implant. And so in that way, the patient doesn't even know that we really did anything other than a few sutures in the gum tissue. We would let it heal in that scenario anywhere from 3 to 6 months, depending on how solid the implant went in at that time. And then we would come back another day and then add that second part on it, or the abutment. And that is actually bringing the implant through the gum tissue into the mouth for a tooth to be placed on it, or the dental crown.
So one doesn't get, it's not everything done at one setting.
Occasionally we are able to do that. Occasionally we're able, if the bone is adequately strong enough to support the dental implant and the abutment, we will go ahead and do that all in one procedure. Especially on front teeth, we like to do that because there is the cosmetic concern that patients have. So if we're able to get an implant in that's very secure, and we can go ahead and place a tooth on it right in the same visit. So we do have patients that come in, they'll have an extraction done that day, and they'll walk out with a dental implant and a tooth on the implant all in the same visit. And that's a great service to offer.
I can imagine. Now, again, because we are in Kentucky, and it's not just Kentucky, surely, but a lot of people wear dentures. Now, I guess the standard way when people wear dentures is that they have a plate, and it gets what? Glued into the mouth or to the gums, or how does that work?
Yeah, sometimes they have to use dental adhesives, and there's actually, the two types of dentures would be an upper denture or a lower denture. The upper dentures patients seem to tolerate fairly well. They do have the benefit of the suction of the roof of the mouth, that helps to hold the denture into place.
I would have thought that would fall out because of the gravity.
It actually does create a little suction for them between the denture base and the roof of the mouth. The problem that most patients have, the elderly patients have with lower dentures, is that there's a tongue down there, and the tongue seems to knock that denture around and not allow it to be steady. So, and they cannot create suction. So there are options for older patients when they are faced with having to wear a denture to stabilize that denture.
Let's take a look at this slide here that shows, I guess, some of the options that are available.
This slide is showing various ways that if someone is missing all their lower teeth, on different ways that we can provide teeth back into the oral cavity form for their lower jaw. The slide to the left is basically showing a tooth root essentially for every crown that's placed. So it would be a total, it can be up to 8 to 10 dental implants in the lower jaw with a bridge basically that is cemented or screw retained onto all those implants. That is a fixed prosthesis, meaning that appliance does not come in and out of the mouth. They have to go to their dentist to have that actually removed. And that is the closest thing to getting teeth back into the lower jaw like their natural dentition. The two slides to the right are illustrating two different ways that we can actually have a denture made, for a patient and keep the cost down by placing either 2 or 4 dental implants. We can do it as simple as 2 dental implants in the lower jaw. We keep the implants more towards the front, towards the chin area, and the denture is actually stabilized onto those 2 dental implants. The 2 dental implants have a ball attachment with like an O-ring type insertion on the inside of the denture that will anchor onto those dental implants.
Okay, Chris, we just talked a little bit about the dentures. Show me what these things actually look like.
Well, this is just one of the options that you have available. Dr. Livesay said a second ago, there are a couple different ways you can do this. This is the 2 implants toward the chin that he has spoke about earlier. And then once the patient comes back in, the oral surgeon has cleared the patient to be restored, they'll go back into the general dentist's office and they'll take this abutment and they'll torque that into place. Once that's torqued into place down to 35 Newton centimeters, they'll then take an impression. At that point, the impression is sent off to the lab, the new denture is made. They'll come back in, and according to the patient, how much force they can use to remove that denture, there's a series of O-rings that we talked about that'll be placed into the denture, trialed in so they can remove the denture on their own. They'll bite it into place, and now that'll eliminate a lot of that motion they've had over the years.
Now, the other mouth piece that you have right there, what is that demonstrating?
This is kind of demonstrates the different sizes of implants that are out there available. What Dr. Livesay said earlier was the fact that you're trying to fill as much space as possible. So there's a lot of different options out there as far as sizes of implants. So this will show you in narrow places you have a narrow implant. In a little bit bigger places you have a little larger implant for restoration. And then back in the molar region, a lot of times the back teeth, you want to put as much big of an implant as you can in there, because you're putting a much bigger crown, so you can place a wider implant in the back of the mouth.
So Kenny, it sounds like there really isn't any reason for someone not to have an implant or something put in.
There's very few contraindications to dental implants. Poorly controlled diabetes or patient population that are poor wound healers, they may be a consideration to avoid dental implants. Heavy smokers may be another indication. Outside of that, as long as you have adequate bone to place a dental implant, you're a candidate for a dental implant.
What about the patient that's had radiation for a cancer in the head and neck area?
That's a great question. Those patients are in a big dilemma because they certainly oftentimes are missing part of their jaw, sometimes teeth, and there's few things that we can offer those patients. There is a treatment modality known as hyperbaric oxygen where sometimes we can reverse the radiation process in the jaw to allow for dental implants. So in some of those patient population, depending on the dosage of radiation and the therapy they've had after the radiation therapy, may allow them to have dental implants.
Boy, it sure sounds like the role of implants is one for aesthetics because people look better. And I'm sure it gives great confidence to people that when they have a mouthful of teeth, they want to smile more, and perhaps this makes them more engaging to other people. On the other hand, it sounds like it's also one of therapeutic benefit because you're preventing bone loss, improve the overall nutritional status of the patient because they're eating better. So it sounds like a win-win situation. I sure hope that we do follow the first thing you said, though, brushing our teeth twice a day, using floss, and trying to maintain the teeth we have because apparently they're supposed to last us a lifetime. If you have any questions or concerns about this subject or any other subject, please feel free to contact us at www.kentuckyhealth.louisville.edu. We look forward to hearing from you, and I'm sure if you have any questions about this particular show topic, please feel free to contact our guests. I'd like to thank you very much for joining us on this segment of Kentucky Health. I'm Dr. Wayne Tuckson, and again, for my guests, Dr. Livesay and Mr. Frudenberger, thank you both for being with us, and thank you for joining us on Kentucky Health.